The statistics around job changes are pretty obvious. I mean, you do make more money and you get further in your career if you are willing to move, change, try something new. Some people really love being at one place and that's it for them. But you will grow so much as a veterinarian if you do challenge yourself and you try new things.
Hey everybody, welcome back to VetFolio Voice. I'm Dr. Cassi. So happy to have you here for an episode where once again I am joined by one of my favorite people to podcast with, Dr. Tannetje Crocker. This episode will also be posted on Questions with Crocker, so if you haven't checked that out before, be sure to head over there and listen to some of her episodes. She's got some really great content as well. And in this episode, we got into career transitions. Now, this topic is going to look unique in every situation, but we shared our own experiences with the transitions we've experienced in our own careers and some of the challenges, some of the wins, and just what it's looked like for us in case it might be helpful for someone who is considering a career transition. Veterinary medicine is such a cool field. There's so many opportunities to branch out into different parts of the veterinary industries. And if you want to talk about it more, this is a topic that Dr. Crocker and I have both experienced and are really passionate about, taking the leap, the transition that feels right for you. So you can always feel free to reach out to her, reach out to me, if it's something you're dealing with and you want to talk about more. As you can imagine, we chatted for quite a while on this topic. We both had a lot to say, so let me wrap up, introduce Dr. Crocker if you don't know her, and we will get into it. Dr. Tannetje Crocker is a 2009 graduate from the Texas A&M University College of Veterinary Medicine. She's passionate about mentorship and empowering both veterinary students and young veterinarians to embrace the profession and find joy and success. Growing up, Dr. Crocker was always passionate about horses and was inspired to become a veterinarian. And since graduation, she's worked as an equine ambulatory vet, small animal general practitioner, and as an emergency veterinarian. She currently lives in Texas with her spirited 9-year-old daughter, funny 5-year-old son, and supportive husband of 15 years. Let's go ahead and get into it.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on VetFolio.com.
Well, I'm really excited. I'm joined once again, Dr. Tannetje Crocker. Thank you. It's always so much fun to talk to you. And we're going to get into a topic where, I'll be honest, I feel a little bit vulnerable because I'm kind of in the middle of it right now. We're going to talk about career transitions.
I love this topic because I feel like on my podcast, Questions with Crocker, it is one of the most common questions that I get. It's probably because I have worn a lot of hats in this profession. So transitions, I'm really comfortable with, and I have learned to kind of say yes to doors that are opened, and I've gotten to do a lot of different things. So just for a backstory, so people know, I was the horse girl in vet school. I got out of school and I did the equine internship. I was equine ambulatory for 4 years. And then I transitioned to small animal relief. And then I did small animal GP and found ER relief, which I really liked as an equine girl. And then I transitioned into full-time emergency work. And along the way, somehow bought a general practice that I don't work at every day. I have an amazing team that is there and helps take care of the pets and the clients. And I go there a couple times throughout the month and work. And then I also do a little bit of, teaching and speaking and different fun things and social media. So I think that one of the best things about this career is we can pivot and we can make a change when we want to, or when our life stage needs to. And I really, especially like letting young vets know, like make a decision, pick a path, but just know that sometimes that path might need to be redirected, and that's okay. And it's kind of exciting if you think about it, all the things we can do with our degree.
Oh my gosh, I love that. It's like we're having the exact same thoughts here. And when I was first asked to do this job at VetFolio, and I was like, what do you mean? Like, why me? Similar, not necessarily. I mean, I guess a little bit the large animal, small animal. I didn't work large animal when I was after I graduated, but certainly like all throughout school, went to work on dairy cattle, ended up in small animal, but then did emergency and GP and mobile and brick and mortar and relief and associate and ownership and all of these different things. And I agree. And now, here I am at VetFolio doing this podcast with you. And you're right, there are so many different hats that we can wear, which is one of the amazing things about our degrees. And I love what you said about saying yes to doors that are open. I think that's a huge part of it is, sometimes you just got to be brave and you just got to leap, do your due diligence, feel comfortable, but it's amazing the different opportunities that there can be in this career when you look for the open doors and then, you just kind of deal with the adrenal squeeze and you go, okay, and you walk through them and see what happens. And the other thing I really like that you said that I feel like echoes my own thoughts so closely is, like you said, make a decision, do your best, make the best decision you can with the information you have. And if it doesn't pan out, make a different decision. And I know it's not always quite that black and white, quite that simple, but I mean, in so many cases, it is that simple.
It is. I think it's funny because maybe it is a generational thing a little bit where people, used to feel like if you changed jobs or you did something different, then you weren't loyal or you weren't working hard. And the statistics around job changes are pretty obvious. I mean, you do make more money and you get further in your career if you are willing to move, change, try something new. And I think that, some people really love being at one place, staying at that place, and that's it for them. But you will grow so much as a veterinarian if you do challenge yourself and you try new things. And what I found over time is, I put in the hours, I did a lot early in my career. I feel like I got good at a lot of things early on because I was willing to kind of really work hard and try different things. But now I have this flexibility and this joy and really leaning into the things I really love to do that I think is going to make this career sustainable for me. And that's what we all want, right? Like we don't want to just go to work. Like as veterinarians, we love what we do and we're passionate about it. And so finding what works for you in this career is so important because it is hard some days. And you want to have something that kind of fills your cup, but also works with your life and everything else that's going on. So I'm excited to hear about, where you're at and talk about the specifics of transitioning and things that you could do that might help. But yeah, I think it's a good topic for sure.
It is. It is. Gosh, I really love all of that. Like, I'm excited to jump into this with you because just in the last, whatever we've been talking, 5 minutes, everything you've said, it echoes my feelings so completely. And kind of like I've alluded to, I'm in a little bit of a transition period right now in my life and my career and things like that. And so for the last, I don't know, I graduated in 14. So however long that has been, I've been in small animal GP. And like I mentioned, that has looked different at different times. Sometimes it's been relief, sometimes it's been brick and mortar, mobile, associate, and a little bit delving into emergency, not a ton other than handling my own emergencies and the occasional ER shift. And I got to a point recently where I needed something to change for a number of reasons. And I feel so lucky that I've been able to work with an amazing ER team. And so dipping my toe into ER now, and it's terrifying and I'm constantly overwhelmed. But to me, that says I'm in the right place, that I'm doing the right thing. When I feel challenged and I feel pushed out of my comfort zone, with the very important caveat that I have a safety net, that when I get too far out of my comfort zone, I always can phone a friend and say, hey, what do I do here? Come bail me out, talk me through this, whatever it is. So I think that's very important when you're pushing your boundaries. Make sure you have a good mentor, a good safety net. But yeah, it's been a really interesting transition and gosh, I'm having a blast.
That's good. I mean, one of the main things people ask me is, when you went, especially from equine to small animal, like, how did you do that? Were you scared? Were you nervous? And I do tell people, one, I think that I have a very confident personality, right? And I'm also like kind of, I'll fake it till I make it. It's part of
Do
my
you,
theater
I'm sorry.
background.
I don't want to interrupt you, but I have to know if I'm the only one that has this experience. Because you and I think we're about the same height. Like we're somewhere around like 5'1", 5'2". And do you have people like have this epiphany months after meeting you and be like, you're not very tall?
Yes, absolutely.
Yes.
Yes.
And I'm like, I always tell them like I have a big personality.
Yeah. And when I
Yeah.
did, oh my gosh, when I did equine, it was so funny on emergency, especially my husband would go with me sometimes and I'd get out of the truck, and he'd get out of the truck and everyone would go up to him and be like, Doc, da, da, da. And he's like, no, no, like that little one over
That
there,
one.
like that's her. She's going to handle it, and I would. But yeah, I think, just my theater background and just I moved a lot growing up and I had to be really adaptable and I'm extroverted. And so I do think I can handle some of these shifts a little bit easier than some people do. But really it's like you said, it's setting yourself up for success with a good foundation, a good mentor. When I went into small animal relief, I found a couple practices, and one especially where the doctor told me, I used to work on his donkeys, actually. That's how I met him. So he knew me as a vet. And he said, you know how to communicate. And that is the hard thing to teach. He said, I can teach you and help you with spays and neuters and dentals, but knowing how to communicate and talk to pet owners, you already know that. And so it kind of gave me that confidence of, I can talk to people, I can get them to understand what I'm saying, what I'm recommending. And it took a little bit of pressure off. And then having someone there that could help walk me through some of the higher level things that I just hadn't done in a while. But then also, once I was doing it well, like really encouraged me to keep pushing myself, trying different surgeries and doing things. I mean, that was what I needed at that point in time, like the support, but also just someone having confidence in me that I could do it.
Have lots of questions about the theater background. Would love to know more about that. But before I ask you about that, I want to go back to what you said about, that the communication and the fake it till you make it, because I think that those things that you're listing, that confidence, that extroverted personality, probably definitely work in your favor in a
Mhm.
huge way. What would you say to somebody who maybe doesn't feel like they possess those same personality traits, but they are still wanting to make a transition? So maybe they say, my client communication is fine, but I don't necessarily feel like I have that confidence or that ease in communicating with clients.
Think that, just like everything else in life, I think we can practice certain things that make us uncomfortable. And so I actually give a talk that's networking for introverts. It's a really popular talk at conferences because the majority of veterinarians are very introverted. And I really talk about leaning into, especially if you are more introverted, the fact that in a quieter setting, one-on-one, you actually really connect well with people. You're usually really empathetic. You usually are a good listener. As an extrovert, I'm looking around wanting like everyone to have a good time. And I'm kind of, I think a little ADD about things, and it's hard sometimes for me to like really focus. It's probably why ER works so well for me. But I really think like I see such great communication and intentionality behind people that are maybe a little quieter. And I think that you really can work on your spiels for different things. I mean, in the ER, you see the same things over and over. So think about like, what are the main things that you want to talk about with parvo, with a hemo abdomen, with an emergency, with those financial conversations that are uncomfortable? Like, what are some things that you can say? I'm all about addressing the fact that it's a hard conversation. So I will say to people, I hate having to talk about this right now, or I know this is uncomfortable, or to move forward we have to talk about finances, and I really don't enjoy this part, but let's just see what we can do and come up with. And so trying to give people like little tips, tricks, phrases, things, and then them practicing those, I think can be really helpful. I also think learning to read body language is great, and there's ways that you can learn more about that, how to look at clients, how you can kind of stand, act, hold yourself that actually makes you look more confident. I mean, think about interactions you've had with people and things they've recommended. And I mean, someone that just says, this is what you need to be doing. Like, you're like, yeah, like you feel so confident that that's what I need to be doing. If someone's kind of like, well, you could think about maybe doing this, but like, maybe we could do this, but like, you don't have confidence in what they're saying, right? So there's some very tangible things that people can work on with communication, with body language, that will add to their confidence. And then as you're doing it more, I think you just get more and more comfortable with it overall.
That makes sense. It is sort of like a fake it till you make it. Like have your spiel so you don't have to, synthesize all that information fresh each time.
Mhm.
And
And sorry, one more thing,
yeah.
play out worst case scenario. Like I do this a
Oh
lot with
gosh,
the new
yeah.
young doctors, because they're like, well, what if this happens? Let's talk about it. What if that happens? Like, let's play out the worst case thing that could happen. Let's play out, you lose a patient under anesthesia. And so that's making you scared of surgery. Let's play out, you have a client that starts to be not nice to you. Like, let's play out the scenario. How are you going to handle it? What are you going to think about? What have you done up to that point? And ultimately, I don't think anything is ever as bad as we actually think it's going to be. But if we kind of have already thought out worst case scenario and realized that, worst case, you are still a person who cares, who has tried your best. You have people that love and care about you. You have a support system, and you are here, and most of the time help animals in the most incredible way. Like that's the take home, right? So kind of work through some of those mental exercises and really strengthen who you are as a person and a veterinarian at your core.
And I think that comes naturally with time and
Mm-hmm.
experience, but it
It
can be
does.
really hard in the beginning. I think the term I've heard for that is fearscaping.
Mm-hmm.
Like I remember I was talking to a colleague, this was a little while ago, where something had happened with one of our patients, and we didn't know if it was something that happened as like a medical error, or if it was something else that was going on. But of course, like all of us do, had internalized it and, was spinning, which I've definitely been there
Mm-hmm.
more than
Mm-hmm.
one, two, three, four, five
We
times.
overanalyze. Yeah.
Oh gosh.
We're
Oh gosh.
perfectionists. I mean, that's our personality.
Yes, yes. And it was the what if, what if, what if. And we were talking, and I was like, listen, you already have yourself like blackballed from this profession living in a box. Like
Yeah.
nothing that person says to you is going to be worse than anything you've already said to yourself. Like it can only get better from
Mm-hmm.
here. So I think that's such a good mental exercise to really play out that worst case scenario and realize that almost always it's not, the worst case scenario is not something you can't handle.
Absolutely. It's funny when I went to buy a general practice. My husband and I do this a lot because we own a couple businesses and we're very entrepreneurial. And he said, okay, worst case. I'm like, worst case is everyone quits. Like everyone in the hospital quits, right? And he's like, okay, so that means you're a veterinarian and you can still work, right? Like you can always practice in your own practice. And he said, and we have a practice manager who is a partner in this. She can always help you. She's a technician, and I can work the front desk. He was like, worst case scenario, we can handle it and we can hold down the hospital. And so for some reason, like just the fact that I'm always going to be able to make a living and that I have this support system of these people that are great and would support me. I mean, it really took the pressure off of making this huge decision to jump into practice ownership.
And I think that is essential to being entrepreneurial and being willing to take those
Mhm.
risks. But also, even if you're not an entrepreneurial person, it's essential because some of the things that we do, some of the decisions we have to make, we don't always know the outcome. And
Yeah,
so you do have to have this degree of mental fortitude to say, you know, I'm making the best decision I can with the information that I have. And, here's what I'm going to watch for, and here's how I'm going to adapt if this turns out to be the wrong decision.
yeah. I mean, the best example of that is I work a lot with new grad emergency vets, and I love it. I love mentoring, and teaching them. And so they'll see a vomiting diarrhea dog, and I'm like, okay, what's your plan? And they're like, well, obviously, blood work, pancreatitis test, ultrasound, x-rays. I'm like, that all sounds great. The owner has $300. Now what's your plan? And
Yes.
it's such a good, like, okay, yeah, you want to know, like they want to know everything going on with the pet. They want to know all the information so they can really tell this owner like what they need to do and why. And unfortunately, we often don't get all the information, and we have to go off of our exam and the conversation and deal with owners' finances and expectations. But I love it because I think that's such an important part of being a veterinarian, is being able to kind of push past the fact that you're not going to always know. and you just have to make the best decision you can at that moment.
And I think that kind of circles back to another point of being honest with pet owners.
Mm-hmm.
Kind of like you were saying when it comes to talking about finances and things. I know this is an uncomfortable conversation. I know this isn't what I want to be talking about right now either. Or if you are, I process out loud. And so I have gotten myself caught in a spot sometimes where I go into this thinking out loud, and I can be that person you were describing where I'm like, well, we could do this or we could do this. And I've had to learn over time to take a step back so that I can portray that confidence and say, I'm sorry, I'm running scenarios through my head because I'm not sure, because if this happens, then it would lead me this way. If this happens, it would lead me this way. And I'm just trying to make sure that I'm making a plan for you that is as targeted as possible and giving us the best, picking the best diagnostic that's most likely to give us the answer
Mm-hmm.
here. And we're putting our resources to use effectively. And most owners are really responsive to that,
Yeah.
to say, oh, this isn't you not knowing what to do. This is you trying to figure out how to best treat my pet, knowing that maybe I have that $300 and I'm
Yeah.
not going to have all the information. So how am I going to use it the most effectively?
Yeah. And I think being honest about that, I'll have people say, okay, so we're going to do this because we think this is what's going on, but today we couldn't do the blood work and we couldn't do this. And so we're going to try this. And if it doesn't work, you just know to follow up with your vet tomorrow. Like, it's not the end of the world, right? But like, just know that you need to do the x-rays if it's not improved, or you really are going to have to follow up and get that blood work done. And so just setting that expectation, but knowing that I am making the best decision I can with the information I have, I'm confident in that. And, you're going to have limitations as a veterinarian. And I think for me, kind of trying to MacGyver things and do what I can with what I have is actually one of my favorite parts about working emergency.
Absolutely. Yeah. The other thing that I found that's new about working emergency that I want to ask you about is the workflow.
Mm,
So in GP, any manager who's ever worked with me is like nodding their head if they're listening to this. I am always behind. I am always running behind
okay.
because I chit chat. I'm in the South, like we
Hmm.
talk,
Hmm.
and there's just a lot to explain. And
Hmm.
sometimes I feel like I I don't quite feel right if I have information and I'm not sharing that with the owner. And I hate when time gets in the way of that, but of course it does, because that's how GP works, and I completely understand all of that, especially having been a practice owner myself. But I'm constantly behind. And I found in ER, of course, we still have to move with efficiency, but the workflow I found to be different, where sometimes I do have a little bit more time to really sit down and hear the whole story and share all the information and talk to owners. So you tell me from an ER perspective, am I setting myself up to get behind and run into the same problems in GP, or where's the balance there?
Yeah, I mean, the nice thing about ER is you're not getting behind because there's not a set appointment time, right?
Right.
Like, they're coming in. Now, I will say you will probably get more frustrated owners if you're not moving through a case as efficiently as possible. And I do think this kind of speaks to there's so many types of like ERs and urgent care. So, it sounds like you might work in a little more traditional one. I work for Veg, so it's open concept. So the owners can see everything happening. They can see me talking to other owners. They can see me doing surgery. So, their perception of like she's busy and has a lot going on, like they see it. And I would say, because I work nights, I think especially, and so it's always busy pretty much. I rely a lot on my technician team to really communicate a fair amount of things. And we do a lot of training in regards to that. So, for example, a blocked cat, they're going to come in, really, they're going to get triage, and I might not be the first one to touch them. The tech says, hey, I need a doctor over here. It's a blocked cat. I come over, they start getting things ready. I start explaining to the owner what's going on. But I'm going to give kind of a broad overview. And then we have really trained our technicians that when they go over that estimate and we're talking about, we might need to give these things because we think the potassium level is going to be high. And this is a concern because A, B, and C, like they can communicate that. Would I love to have the time to sit and like talk all about it? Maybe sometimes, I don't know, maybe I
Sure.
work emergency because I don't want to do it. But I think that, when I have other cases that are waiting on me, like I'm trying to just move through as efficiently as possible. So for me, I have found that owners are happier the quicker they get in and out. So there's not like a set time where anyone's going to tell you, hey, Cassie, you're getting behind, right? But I am always looking around and saying, okay, blood work's running on that one. So I like am making a note, check that blood work in 15 minutes because it should be done. And I want to circle back with that owner because I want to like move through to the next step, right? In the next plan. And I'm very much managing the floor in that way. But the client communication, I like to sit on the floor. I like to talk to people, but I am going to really stick to the basics of information because I think that you lose people sometimes. Like we want them to get the information, but too much information, you just kind of see people like get a little lost. And so I really stick to like the bullet points. And if people want more, a lot of times they will ask my technician, like, oh, she said that she was going to do this. Like, what is that? Or do you know? And I don't spend the time really getting in the weeds with those types of questions unless I really have extra time, which I usually don't. I don't know. So how is your setup? Is it a more traditional, like people are in rooms, and how are you working through cases? Does that make sense?
Yes, yeah, it is. It is a little bit more traditional setup. The rooms are like really comfortable. They're not
Mhm.
clinical. There's like couches and dim
Oh, nice.
lighting and stuff. So it's really comfortable, and there's free refreshments and stuff like that that people can get. So it helps time wise. And I completely agree with you with moving through things as efficiently as possible. Like I never try to delay something unnecessarily. But yeah, people are in the rooms, and it sounds like there's a cultural component to this of, what the expectation is as far as technician communication versus doctor communication. So it sounds like that may play a role in workflow and time spent.
And it's a training thing too.
Right.
We'll whiteboard, disease processes and then ask the technicians, like, what are the most common questions you get asked? Okay, let's make sure we're answering those because when pets are hospitalized, the owners can be there. And so, a tech's going in there and checking different things and getting lab work for different things. And they're asking, well, what are you checking for? And what are you looking at? And so, I can't go in and answer those questions every single time. But I do think that, it's nice to be able to trust that the information being given is accurate. And so depending on how busy an emergency room is, and I'm an impatient person, so I don't want to wait. And so, if even if like blood work's taking a while, or if, in your setting, if it's taking a while to get a catheter in something, like I will have a team member go and tell the owner, like, hey, your pet's doing okay. It's just we got some old cat veins. It takes a little bit of time to do the catheter. Like I just am really big on over communicating, especially when it comes to time and next steps and things like that. And I think that people are happier in that regard. But I don't think you'll ever get behind. You actually will worry about that less in an ER setting as long as you're moving through patients, and checking in with everybody. There's not like a set time they have to leave usually. So
Which is like wild to me. It's like a whole new world, and I'm like, wow, I can just really get the whole story here.
yeah.
And I agree with a lot of the points that you said. Where I think where we start to get frustrated and anxious people is when they're separated from their animal and they don't know what's going on.
Mhm.
And so yes, absolutely, like those check-ins to say, hey, everything's your pet is doing wonderfully. We love them, and everything's going great. This is the reason why. This is what we're waiting on right now. This is what the
Yeah.
next step is. And as long as we keep people in the loop and don't just like leave them sitting forever and ever. And then, certainly in an open concept, I feel like sometimes people can appreciate it sitting in the lobby in our more traditional setup where they see how many people are coming in and out of the door
Oh,
and they're
yeah.
like, oh,
Yeah.
it's hopping here. But certainly in an open concept, I would imagine, like you said, people can look around and go, oh, there's a lot happening here.
Yeah. I mean, I have people every shift who, four people always come in at the same time. Like, don't you feel like you always get like
Yes.
it's a group, right? And so, I'll be like, hey, I'm Dr. Crocker. I'm going to work through everybody, but like maybe one of them is pretty critical or something. And so that will be like we're like working on it immediately. And I'll go to say, what's going on with your pet, just like quick triages with everyone else. And I will always have an owner who's like, my pet's fine. Like, go take care of that one. Like I will have people say like, we are good. Y'all are busy. I mean, it is amazing for people to like recognize that and appreciate it and like understand the triage process because they're seeing all of it, in real time. And so it makes me really proud of our team when we have people who are actually being super patient and understanding and so kind about things and see how hard the team is working like constantly. Because we work really hard, in the ER. And so I do think that transparency helps. And like you said, if they're sitting in the lobby and like, things are just pouring in, they're like, okay, this is why I'm waiting for a
Right.
room.
Yeah. Oh, I love that though, that you really get to see like the best of people's humanity. And going back to the communication piece, if you do have one of those owners who, they're little white fluffy, usually it is, vomited one time and they're having a meltdown over it, worried that something's going to happen and it's going to be terrible. That over communicating, I think, can really help, just to go and do a quick exam and say, here are the things that are telling me like your
Mhm.
dog is okay for right now. Like nothing is going to happen in the next 5 minutes. They have pink gums, heart rate's okay. They don't have a
Mhm.
fever. They seem pretty hydrated. And, even if you can just have a quick, like 5 minute
Check in.
conversation with that person to say, okay, you're not going to let me go walk away to the critical person because you walked in first and you're
Yeah.
convinced that something horrible is happening. There are ways, I think, that we can navigate that and reassure people,
Yeah.
and create that patience that we need so we can deal with the more critical cases.
It's amazing how much like you explain triage and you feel like people should understand it. And then, you get into it and I get it. People are worried about their pets. So I try
Yeah.
to be very patient about it. But sometimes I'm like, okay, like your dog just has THC toxicity and is high and he's going to be
Right.
okay.
I had one of those the other night. Ah,
And they think
it
they're
was very
dying.
mild, thank
Yeah.
goodness, and he
Yeah.
was fine. But it was, we all got a little bit of a laugh out of it
Yeah.
because he was perfectly fine.
And it always makes me laugh. It's like the boyfriend's daughter or something. It's like some
Right.
random, it's like
Oh yeah.
some story behind it. And they're like, oh, I knew it. So,
Yes, at least I feel like at least now people are much more willing to talk to us about it. We're like, is your dog high? And
mhm.
much more honest to say, yes, that's what's going on. You're like, okay, good
Yeah.
news. I think we're gonna be okay here.
Yeah. We can move on to the next thing. That's
Yes.
so funny. Do
Oh,
you see, okay, I'm gonna ask you a question, sorry.
yeah,
But so because you were doing house call, right?
I
Most
was.
recently. And then so with the price differences and the cost difference, is that been hard to kind of wrap your mind around and kind of talk about? Because, you know, I guess you're probably giving like higher estimates and doing higher level things, obviously. So do you get a lot of pushback from people versus like when you were doing house call, or do you think it's pretty similar? It's just you're talking about different things when it comes to
Um,
talking about money.
yeah, I haven't really encountered much of a difference because yeah, certainly the costs are higher on some things, but I think the messaging around ER care in vet med has been good. So I think there's a little bit of an expectation that there's going to be a higher price tag associated. And GPs, GP practices do tend to be a little bit more able to see urgent cases, maybe not necessarily true emergencies, than we were, say, in like 2021. So I think that's created a little bit of a balance. And then, again, going back to the communication piece of saying, hey, this is the ideal plan. If that's not what's going to work right here and right now, here, either well, your dog is stable. And so we can, kind of like you mentioned earlier, we can treat symptomatically, but you may have to follow up with your GP tomorrow or come back to us. And that's another safety net I've found
Mhm.
in ER, that the hours are long. So I can say, hey, if it's not getting better, like I'm
You
here
come back.
until
Yeah.
really late, so you can come see me. And I think as long as people have that out and they have options and they see us trying to work with them with the resources they have available, most people, not everybody, but I think most people have been really receptive to, the different plans. But I think the exercise you mentioned earlier of, okay, what if you only have $300 is really important. And man, I think that applies in brick and mortar. I think it
Oh,
applies with
everywhere.
house call. I think it applies with ER, of kind of loosely having that plan A, B, and C in your
Mhm.
head. And what is the least amount of treatment and diagnostics that you feel are safe for this patient? And, being able to kind of shift and adjust to make the best decision you can, even if you have limited resources.
Well, and it's easier if you have been doing it longer. I mean,
Right.
I think there's cases and I joke it's like my spidey sense, but
I
they've
see
shown
that
there's
too.
yeah, there's like data around, when you see so many cases, you kind of just start to think like this is really serious. And even if a pet's like wagging its tail, there's some dogs that I'm like, I just really feel like there's more going on with this pet, and
Mhm.
then there's some that look okay, but I'm like, this dog's gonna be fine. So I do think there's like a degree of comfort you get just the more cases you see with kind of if an owner does have financial constraints, with saying, you know what, like, I think that you can do A, B, and C and recheck with your vet tomorrow when they're open, or, you can always come back. At Veg, we don't charge the exam emergency fee if they come back within 24 hours.
Same,
So
yeah.
that gives another nice buffer. Like a lot of the emergency urgent cares do that, where, okay, you're not doing the diagnostics now, that's fine. But if they do throw up again, we need to do those x-rays. So come back and we'll just continue it like you never left. And people really do appreciate that, and kind of setting up what the next steps will be based on their pet's response. But I really like to stick to like emergency stuff. The funny thing is, when like we had a dog that was a dystocia the other day, but also had like skin issues, and the owner's like really wanting the skin issues worked up. And I'm just like, let's get through this. Like, can we just get her puppies out, avoid a C-section, and, we'll deal with the skin and the ears and the stuff later on. And so it was just funny to me how sometimes people will be like, oh, and they've been doing this for 3 months. And I'm like, okay, what's the emergency? And like, what,
Right.
should your GP be
You're at
addressing?
the ER.
Yeah. Yeah.
Yeah. Well, I think that brings up a really good point of something I'm trying to figure out is like the boundaries for ER versus GP, because I do feel like, primary care practices are potentially able to see more cases and things than we were a few years ago. And so I always am trying to strike that balance, and I never quite know where the line is of I'm here to work up this issue, and maybe there's this other issue that ties in, not talking dermatology, something
Yeah.
else,
Yeah.
that ties in. And I could kind of go down the road of doing some diagnostics on that. And so I struggle sometimes of like, do I stick to the one issue they presented for and then say you have to follow up with your primary for everything else? Because I never want it to feel like, oh my gosh, they're stealing our case. We could have done that and they did it. They should have sent it back to us. But I also don't want to send a case back and have, a primary care vet say, well, you had them there. Why didn't you just do it?
Yeah.
Now I have to do all this work. So what have you found to be like the balance of those issues?
I do think that, I mean, obviously anything that I think could be affecting our treatment plan or affecting like what we're doing in the emergency situation, I'm going to make the recommendations to kind of keep following up, or to do more diagnostics, or to do whatever, whether it's with us or their general practitioner. Like, I'm going to talk about it and kind of go over how emergent we might need to do those things. The one thing I think that helps, and this can be tough, but if you are working at the same ER, getting to know your referring vets can help a lot.
Sure.
Because I would say, like, when I was in GP, if I send something to the ER, just do it, do everything. Like, I don't need to see them back. There's some, GPs that are like, take it, do the things, maybe the client's high maintenance, maybe the dog does have multiple issues. They just don't, they're not dealing with it, right?
Right.
But there are some, and we have some that we know, if we do certain things and if we hospitalize, like, they are going to want those patients in the morning. Like, we have some referring vets that are like, they want to hospitalize, they want to do the things. So we kind of try to set expectations. If we think a pet is able to go back to a general practitioner, we'll call your vet in the morning, we'll update them on the case, we might be able to send you back over there. The cost is going to be a little less. So I really think, if you're going to stay consistent at the same ER and you're getting a lot of referrals from like the same type of people, you kind of learn like what the different GPs are looking for. And you could even ask if they're calling to like refer something to you, like, a renal failure cat. Okay, well, so is this something that you maybe want us to hospitalize for 12 hours, 24, and then maybe you want it back because ideally it's on fluids for a couple of days? Do you guys hospitalize? Do you not? And I would kind of feel out some of those things. And I think it'll set you up for a better relationship with your referring vets too. But it does take just a little bit of extra communication for some of those things. But I wouldn't ever say like, I'm not going to do that at all because GP could. I'm going to talk to the owner kind of about what it would take. But working up, skin issues in the ER is going to be dramatically more expensive than doing it at the GP. So a lot of times people talk themselves out of wanting to do all the things with us.
Yeah, no doubt about it. But I think what I'm hearing you say is that the answer is really nuanced. It's really depends on the situation. What is the other issue that you're dealing with? How does this GP practice like to handle
Mhm.
patients? And how does that owner feel about this? And then making a decision there, that there's not like a hard and fast rule of like, this is what you're here to work up and this is what you're not. You just have to kind of feel out the situation and try to make the best decision.
And I mean, honestly, I used to kind of say like, well, your vet's gonna open in like 3 hours. So, we could do this, but you could go there. And I expected more people to be like, yeah, I'll just go there. But I am shocked how many people are like, nope, I want to do the full workup. We're here now. Like they're good with the estimates and they just want answers in that moment. And so I think that's what we're there to do. And eventually, the regular vets can be involved in some way, whether it's a recheck or dealing with an issue long term. So I don't ever want to withhold offering those things because I'm shocked more and more by people, especially in the night, just saying, nope, let's just do it.
I would agree. I've had that same experience where I'll have somebody come in and this dog appears pretty stable, and yeah, there's an option to maybe go to your primary care in the morning. But yeah, they're like, no, I want to see him. I want
Yeah.
to see him now.
Which
And you're
at
like,
like 5
okay,
a.m., I'm like, do you?
do
It's
you
5 a.m. Like
though?
I'm supposed to be off in 2 hours, but okay.
Okay, here we go. Yes, yeah, I've definitely had that experience. Oh,
Uh, that's funny.
so I mean, I guess you and I are both living proof that you can make these
Mhm.
career transitions, and sometimes it does take a little bit of courage, and you kind of have to leap and hope for the best outcome, do the best you can. But if there was someone listening who was thinking about making a career transition, whether it's from large animal to small animal or GP to ER or the other way around, I'm one of the challenges I feel like we're facing when it comes to transitioning is how fast medicine is advancing.
Mhm.
And so we're seeing this so many more options of things that we can do for patients and things that we can recommend. And so maybe to avoid like creating a whole nother podcast episode right now,
Yeah.
if I picked this specific scenario of somebody who was like me and was working in general practice and said, I think I want to make the transition into ER, but maybe is also someone like me and says, but I really don't like opening abdomens and doing that. And I'm worried about having to do things in emergency that I'm not necessarily comfortable with. How do you approach that conversation, in terms of like maybe someone who's worried about having to be a jack of all trades when there's so much information out there to know and to have to treat pets? I don't know if that made sense. That seemed
No,
very roundabout.
that
Okay.
makes perfect sense. I mean, I think specifically when you're talking about like switching to urgent care or ER, you can be very intentional about where you go. And so, there are some ERs where you don't cut ever and you do a lot of other things. And maybe you do higher level ultrasound or you do, other procedures like you might tap chest or do pericardial taps, like, but you're not actually doing like soft tissue abdominal surgery. And then there are some that require it. And so I think that works for some people. It doesn't work for other people. If specifically you were coming to work, for veg and you weren't comfortable with certain things, we would probably have you do like a 6 month training period that we do for people that are coming in because we do require our doctors to cut, to do endoscopy, to do like higher level things. And we want you to be able to do it with confidence. And so I think, there's so many ways to learn and to grow. And so just making sure that you are open and honest about what you are comfortable with, what you're willing to learn and not learn. Um, the resources are there and it's just more making sure that you have the right program that you can do the things that you think you'll excel at. But there are a ton of ERs that you never have to cut in. So if someone's like, I just don't want to do that, I don't feel comfortable, great. Like just find the right place. Right. And so that's where networking, putting out like what you're looking for, really talking to people about their experiences in different places, I think helps you find the right fit for you. But you might get into that place and you might actually see other people cutting, or you might start getting things and you're having to hand them off to somebody else. And you might start thinking, I actually kind of want to do this. And that's where, going and doing the hands-on advanced surgery trainings that like NAVC and other places offer doing, wet labs at conferences can be really helpful. But I think really just having that mentorship and opportunity, if you want to grow in that way, is the most important thing.
You are defining my experience here
Yeah.
where yes, like I'm at an ER where I don't have to cut, and that's great for me. But yeah, and being in this environment where I feel overwhelmed and I am learning so much so fast, and I have that safety net.
Mhm.
So I feel like I have the opportunity to learn these things. Yeah, it has kind of put me in a place where I'm like, I don't know that I love that I don't like cutting. Like, I
Mhm.
think I can trace it back and tell you why I don't like cutting.
Mhm.
And I don't think that has to be permanent. I think I can get comfortable with the right training, the right mentorship, and, building my confidence up slowly to where I can handle it. But yeah, it sounds like, we are fortunate that in a lot of places, there's a lot of options in terms of where you go. And so, depending on what you have available, it sounds like what you're saying is ask the questions and find out what's expected. And if they say, to someone like me, no, you have to cut abdomens on day one,
Mhm.
well, how, who's going to be with me? How is that mentorship and training going to work? And if you're getting thrown into the deep end without a safety net, I think that's a recipe for burnout
Yeah.
and really, a struggle and a bad experience. But, you know, if the expectations are something that you can live with and you have the training that you need, the mentorship and the safety net that you need, then yeah, then do you want to?
Yeah.
Is that
Yeah.
something that you want to learn and you're willing to learn and do?
What I hear is you're going to be doing PECs within the year
Ooh,
on your GDVs, and I'm going to be like, yeah, go Cassie.
I would love that if that is the case. I was the same colleague I think I talked to you about a different time who loves to cut just anything. Like she's great at it and she loves to cut anything. And she was telling me this story of like cutting a GDV and she's like, I had to stand on a stool because the dog was so big and I was
Uh-huh.
like elbow deep in this abdomen and she was so excited and I was like, you are describing like my worst nightmare right now.
I'm like, yeah, that sounds awesome.
Yeah.
Like, let's do it.
Oh my goodness. Yeah, no, that I was like, somebody was like, can you pull these cat teeth the other day? Cause I also still work in primary care. And I was like, yes, absolutely. Like all day long, I'll do
Yeah.
it.
And some people that would terrify them. Like cat dentals are, I would rather do a GDV than do a cat dental. I'll be
Oh,
real honest with you. So
it was challenging. I will not, it was not a walk in the park,
yeah.
but yeah, I think that just speaks to our capacity to learn and to adapt
Mhm.
and to grow. And so then it just comes down to like, what do you want to learn? How do you want to grow? What do you want it to look like?
Yeah. And are you supported in the right way? And I absolutely think most places, if you have the conversation, you can set up a plan that would work. So I don't be scared. Like the take home is don't be scared to try something new and just make sure you're intentional about where you go and who you're with. And overall, I have grown so much as a veterinarian by being willing to do those things.
I That's like the perfect place I think to close it because I think that's the takeaway from this whole talk of career transitions is being brave, being willing to say yes and the opportunities that are out there, when you do take those chances.
I love it.
Well, thank you. It's always so much fun to talk to you. I've enjoyed it, which does not surprise me at all. I always enjoy our conversations, so thank you.
Thank y'all. It was good seeing you, Kathy.
Yeah, good seeing you too. A huge thank you to everyone who joined us for this episode. I hope everyone who listened took something away from it. Career transitions can be challenging, they can be scary, but they can also be so, so worth it. Tannetje, thank you so much for joining me. It's always a pleasure to talk to you. I always have a lot of fun. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. For more episodes, you can click on the education tab on the VetFolio website or find us wherever you get your podcasts. And of course, I want to hear from you. I want to hear what you thought about this episode and ideas for topics you'd like to hear from us in the future. So reach out to me at dvm@vetfolio.com. We can also connect on Facebook or Instagram at Dr. Cassi DVM. And remember, if one animal is better off because of you today, it's a great day.